Hello everyone and welcome back to the channel A to Z Therapy with Smruti. I'm Smruti Sikta Mishra, a second year occupational therapy student at Delhi University, and the session is with Rupali Gulati ma'am, who has done her Masters in Developmental Disabilities from SV Nirtar and has done her BOT, the Bachelor's from Pandit Deendayal Upadhyay National Institute for Persons with Physical Disabilities, again my college.
It's a 2-year program, like 2-year course, the whole masters. So what it is, it has आपके postings वगैरह जो भी subjects वगैरह होते हैं, कौन से topics होते हैं, you guys read, and India में उसका course structure कैसा होता है, and what's the, I would say, difference between the Indian study, like जो भी उसका procedure है, and the Western countries.
The syllabus is a bit, I would say it covers it all. We have a special pediatric syllabus in which we cover all the things related to that. But in addition to that, we also studied the various kinds of disabilities or various kinds of conditions or various things that were related to the other specializations also. Like, for example, we used to read the management part also, which we will maybe require if we ever decide to set up an OT department of ourselves for ourselves. How does a occupational therapist work as a consultant in different settings? So that is also included. And other than that, various conditions that come under occupational therapy or the occupational therapist can treat. So that was there. And in pediatrics syllabus, I would say that we would start from the basic anatomy, physiology, and then we would go to the different conditions and what condition would inculcate what frame of reference, what approaches, and what kind of treatment would we give as an occupational therapist in the further future. So at the graduation level, you only study the, I would say, the treatment part, right? We would give this treatment, we would give that treatment. In masters, it was a more, I would say, diverse. It was more diverse. Like, why are we using this treatment? Why are we using this approach? So that was a basic difference, or you can say that was a more advanced thing that we learned there.
Yeah, I think this was a similar point. I remember while I was in conversation with even Sherry ma'am, she was also saying कि, ये रहता है.
I think like in Nirtar, as I said, because we not only cover the developmental disability part, right? We are ought to study a lot of things that are not like directly related to the pediatric syllabus or the pediatric setting, right? But yes, you need to know about those things, like what are the disabled rights, right? What is the disability evaluation? How do you do it? And why is the need for it? And who is eligible for a disability certificate, who is not, like that sort of things. Or you can like your role, like an occupational therapist role in various settings. Like in a clinic you have a different role, in a school you have a different role, right? So you need to be aware of different roles that you will be asked, or you will be um, you will be asked to play in different settings, right? And accordingly, in various settings, you are just asked to come and be a consultant there, right? In different hospital settings, you are asked to be a consultant only. You are not directly giving the therapy, you are just there for a consultation. You only are ought to tell the team or the respected personnel to be like, this and this therapy needs to be done, but you are not exactly involved in the process. So you need to be aware of that. And there are different rights of the patient, rights of the therapist, how to work with the multidisciplinary team, how to work with the team members. You need to know that. And in whatever therapy, in pediatric or in adult, I would say that not only the patient is our not only the patient or the client is our main concern. In my opinion, I would say that the parents of the child, or the companions or the caretakers of the patient, they also need to be addressed, right? I mean, for the patient or the client comes to us for almost 1 hour to 1.5 hours for the therapy, but most of the time the caretaker or the parents are have to take care of the child or the patient. So yes, they need to be counseled first, right? Because they have so many concerns and they have so many problems that they are also facing with the client, you know. So yes, we need to address them too. Like along with the client or the child, the patient's the caretaker's concern, the parents concern, they need to be addressed for a better therapy ongoing. Because as we give the home therapy or the home program to the for the child or the for the adult patients, so the caretaker needs to understand the importance of them, that why are we doing them, that what will be how will they find time to for the caretaker to take care of the child. How will they find time, how will they find the resources at home? The most major problem the most parents face, that we don't have the resources, right? Like you have all these equipments around with you, you are so you can easily do that in the setting, right? But what at home, how can we do that? So right, so you need to address these concerns while doing the therapy. It would be a plus point for you also, and it also creates a kind of trust, and the caretaker is more convinced with your therapy, and it will be a good fruitful for you in the future also for the treatment plans.
There are a lot of certifications that is available, like whether you can see for autism there is abundance, like uh, जो भी थोड़ा experience
Yes,
centers and all, everyone has
yes,
that,
yes.
something like that. Every senior therapist has a different approach, different belief system towards it. Can you please name out जो भी आजकल है the courses which are really important, in terms of which you feel कि this is something worth the money or worth the time?
Have not enrolled in any courses like till now. So I have done one or two courses from like IGNOU only, but there are in nutrition and child development, right? So I felt them that it was important for me in this line to have a little knowledge of that. So I enrolled in them. But other than that, OT specific course, I have not enrolled in any like of now. So if anyone wants to do it, so as I said, SIPT is the gold standard in our profession, right? In pediatric setup. So if anyone wants to pursue it, but as it is a little costly and it has certain levels to it, there are I think 3 or 4 levels to it. So per level around a lakh or 1.5 lakh it costs. So if anyone wants to pursue it, they should go for it. If they want to stay in the field, they want to work with the sensory integration uh, treatment approaches, or with the SI kids only. So yes, they can pursue them. Otherwise, there are many courses like oral placement therapy. So it's a very really good course for the oromotor structures, for the oromotor development, for the language and speech development also in the future. So yes, it's a good course. Otherwise, there are many courses with auditory and hearing. I think auditory and hearing impairment child, not like as a disability, but with the sensory issues that they have. So there are courses regarding to that. Then there is your movement therapies, like brain gym. You can enroll in brain gym courses. That's a really plus these days, and it's really very helpful. The movement therapies and the brain gym courses are really good with giving a good result with autism kids. So yes, these are a few courses which are, they never go out of trend in this field.
Yeah.
So yes, you can go for them.
Doing the masters, what should be the attitude of a student in terms of किस तरह से पढ़ना है या किस तरह से पेशेंट्स की जो इंटरेक्शन होती है वो करना है, या आई एम नॉट श्योर वेदर इन pediatrics you do or not, but I've heard कि master students have to teach like Naitar में in to the bachelor students few topics or something.
Yeah.
So how does that help and all? So वो कैसा होता है, like what should be the attitude, if you could summarize it in some few points or something?
Firstly, as speaking of as an pass out from a nirtar, I would say firstly, please keep some points in the mind. Like firstly, keep an open mind and prepare ourselves with the extra loads of work, because in IPH we were not used to so much of work, right? We used to have classes sometimes, do not used to have classes sometimes. In internship also, we get a little bit free time here and there, right? But in Nirtar, you are supposed to work from 8:30 to 4:30. You are supposed to see the patients. The clinical posting is there. Along with that, there used to be our presentations, and which included some case presentations or the topics related to our syllabus, which we need to cover through our presentations only. Then along with it, as you mentioned, like we had to teach some undergrad students. So yes, these were all the responsibilities that were given to us in our tenure of 2 years. And yes, I think you need to be a little more, I think, manage time management is very important in this, right? Because there is so much of work schedule. You have your own work also, then the teaching part, then the clinical part, then the presentations. So yes, you need to manage your time efficiently. I would say that would be the best key point in this, that you need to manage your time efficiently and you're good to go in that.
Thank you so much for watching the video. I hope you liked it, and if you do like it, then do like, share and subscribe to the channel. Make sure you follow me over Instagram for all the daily updates.